capacity. Locally, we have not seen a surge in COVID-19 hospitalizations, but with concern over a possible second wave of the virus, doctors tell our Kelly Ackerman they are prepared.
All the patients in this room, all the feet that you see, they all have COVID.
Early on in the pandemic, we saw East Coast hospitals overwhelmed with severe cases of COVID-19. Hospitals here prepared for that scenario, but we have not experienced it.
By having that lead time, we were able to make sure that we had our social distancing in place. We had a lot of our community actions of shutting down the community, really, and our shelter-in-place orders were already in place before the virus really came rampant in the metropolitan area.
Dr. Larson is part of St. Luke's Health System's COVID-19 response team. Out of its 18 hospitals, there are currently 17 inpatient cases. The number peaked in April with 35. While there's concern about a second wave of the virus, he says hospitals are ready. Necessary equipment is in place. There's more testing now to better track any potential spike in cases, and they know the level of PPE needed.
I remember at the beginning of this, I had to say personal protective equipment. Nobody knew what PPE was. Now that's a common phrase. It'll be added to Webster's this year, I'm sure.
His greatest concern is reopening too fast without taking precautions because COVID-19 is still out there.
The more you see people starting to pile back in and loosen up on some of these social distancing measures that have been in place, I think it is a little anxiety provoking because we don't want to see a massive outbreak.
Kelly Eckerman, KMBC 9 News.
Doctors are also preparing for flu season to overlap with the pandemic. Testing will then be more important than ever because initially influenza illnesses look a lot like COVID-19 illnesses. Dr. Larson is already encouraging everyone to get a flu shot when it becomes available.